Even as countries scramble to address a new worrying virus variant and Europe battles a winter resurgence, health experts say that taming the pandemic over the next year is possible. All the know-how and tools needed to bring the virus under control exist, with ballooning stocks of safe and effective vaccines. But it remains unclear if we will make the hard choices needed or allow the pandemic to continue to rage, potentially opening the way to a far worse situation. A year after the first vaccines came to the market, more than 7.5 billion doses have been administered globally. And the world is on track to produce some 24 billion doses by next June, more than enough for everyone on the planet. But a dire lack of vaccines in poorer countries and resistance among some to get jabs where available have left nations vulnerable as new, more transmissible variants like Delta have sparked wave after wave of infection. But is vaccination enough to stop the spread of the virus?
So it's increasing vaccination coverage, but critically focusing on the people that need those vaccines most. It's not just about 40% of a population. It's the right 40% in that country, the right 70% in that country. And what we mean by that is focusing on people who are at risk of developing severe disease first in all countries. And that's what's really, really important. So we've been trying to speak a little bit more about not just who is vaccinated, but who's missed by vaccination, because that's where we will see the success in this. But it isn't vaccines alone. And I think that's also this false sense of security that if you just get to a certain percentage of vaccination, that the pandemic will be over. And I'm afraid that's not where we're at. We need to get vaccination coverage up to the right individuals, but we also need to drive transmission down. And that's because we have the possibility that the virus will evolve. It is evolving, and this has been happening since the beginning. We have the risk of future emergence of new variants, and we have to do everything that we can. And, in most parts of the world, it is quite simple now to wear a well-fitting mask, to clean your hands, to keep your distance from others. It doesn't mean lockdown. And I think we will continue to say that every single time we say public health and social measures. It's a combination of measures of distancing, and even in the buildings where we live, where we work, where we study, there needs to be more investment in ventilation, which will not only benefit COVID, but it will benefit other infectious diseases, other contaminants, and it's a layered approach. But as you put those layers in, you have to be very careful as you peel those layers away. If you take them all up at once, the virus will take advantage of that regardless of how much vaccination is there. So we're advising to increase vaccine coverage, but also decrease transmission. And this is something we can do because we have tools in our toolbox. Maybe we'll go back to our toolbox analogy. All of us have tools at hand. Leaders need to provide policies and support to people to be able to use those tools, and so they can get on with their lives. I think many countries are finding some kind of a balance of this, but unfortunately this surge that we are seeing in Europe began in June. It's not in recent weeks. It's been steadily increasing for many weeks now. And we're entering our third winter of this pandemic in the Northern Hemisphere. And I can't even believe I'm saying that. In the last week alone, there was an 11% increase in Europe. More than 2.4 million cases from Europe out of the 3.6 million reported globally. That's 2/3 of all cases. And we are seeing not only increasing in cases, but we're seeing increasing in deaths. And this is incredibly tragic because we have tools that can prevent that.
Scenes of intubated patients in overcrowded hospitals and long lines of people scrambling to find oxygen for loved ones have continued. Images of improvised funeral pyres burning across India during the second wave epitomize the human cost of the pandemic. Officially, more than 5.1 million people have died worldwide, although the WHO says that the actual toll is likely twice or thrice that figure. In the United States, which remains the worst affected country with close to 8 million deaths, there has been a constant flow of obituaries. 2 years after the virus first surfaced in China, countries are still bouncing between opening up and reimposing restrictions. Glaring inequality in vaccine access is an added towering challenge. About 65% of people in high-income countries have had at least one vaccine dose, but in low-income countries, it is just over 7%.
I just want to make one last point. When we report cases, it's also imperfect because we're not able to say how many of those cases were vaccinated or how many of those deaths were vaccinated, as well as we would like to, as Mike and I are speaking and rattling off these numbers right now. But we do see on an individual country basis that those who are vaccinated, the proportion of people hospitalized, more people are unvaccinated than vaccinated, significantly. So vaccines work. That's my point. Vaccines work, even against the Delta variant. And so when it is your turn, please get vaccinated and make sure you receive that full course. And whatever you can do, please fight for vaccine equity around the world so that those who are most at risk in all countries get their first and second doses.